Hi, I'm Gabriella Espinosa, a certified women's health and sexuality coach, and I am from the United States. I spent most of my 40s, 8 years to be exact, in what I now know was perimenopause. I'm 56 now, and back then I had not even heard of the word. There was no kind of public awareness or conversations around it. My mother never spoke to me about it, and my female friends all seemed to be doing fine, so there was a sense of shame to even bring it up with them. And it all started off with me just not feeling like myself anymore, and the sense that I was grieving a version of myself I once knew, unsure of what was next. And this grief would show up as depression, rage, irritability with my husband or children, and a sense that my body had failed me. And then the symptoms wouldn't go away. There was anxiety, heart palpitations, insomnia, feeling overwhelmed with things that used to be so easy. It was such a confusing time. And my doctor said it was all in my head. They prescribed me antidepressants, beta blockers. So I took it upon myself to learn everything I could. I researched, I studied, I learned about modalities such as yoga, acupuncture, and medicinal herbs, which supported me then. But then I was diagnosed with osteoporosis in my late 40s, and that's when I turned to hormone replacement therapy to save my bones. And it was such a game changer. In the US, awareness is a big issue facing menopausal women. An estimated 2 million US women reach menopause every year. However, we know that 73% of women are not getting treatment they need for menopause symptoms. And this awareness needs to happen not only as part of a doctor's medical training, but also as part of our health education curriculum in schools, as part of routine checkups with a doctor, and in more open forums in the workplace and in our communities. We also know that in the US, women of color, in particular, Black and Latina women, enter menopause earlier than their white counterparts and experience more severe symptoms. This is due to disparities in our healthcare system, such as lack of access to healthcare and insurance, in addition to socioeconomic and environmental issues. I think in the US, we need access to quality healthcare services by providers who are trained and knowledgeable of menopause, as well as affordable health insurance that covers solutions such as hormone replacement therapy. We also need a workplace that is menopause friendly and has policies in place that understand and recognize the needs of menopausal women. We also need community and to normalize conversations about menopause so we feel less alone and more empowered.